I'm Gabe Charles. I am a civic program manager, and I'm super excited to be here with you guys. You guys know that we're not working in person, but you can find us, you can contact us via our phone number, 414-672-8090. You can send us an email, soc@socmilwaukee.org. And you can also go to our website, www.socmilwaukee.org. Also, that's why I don't have a mask on right now. We're working from home, so that's why you don't see me wearing a mask. But of course, if I was in the office, we'd be following the mask mandates just to keep us safe and sound. I want to know who is with us today. In the comments section, give me a hi, a heart, a like, whatever you'd like. So that way I know I'm not here all by myself. Also, I have a disclaimer for you guys. The opinions and excuse me, points of view that are shared today are not necessarily those of SOC. So I am very excited to share with you guys the interview that we're going to have. We're going to have Marlaina Jackson, the Interim Commissioner of Health for the Public Health Department. It is an interview that we previously did in the beginning of February, but it is super important information, super needed. And then tomorrow we're going to have Dr. Perez and Carrie Ackerman from 16th Street Clinic. And that's on Marlene's Day. And then Friday, Carrie Cooper from the organization called Sewer Pack. And she'll be talking about projects in the city that are taking place. And with that, let's get started with today's interview from Marlaina Jackson, the Interim Health Commissioner for the Public Health Department. I would like to introduce Marlaina Jackson, the Interim Commissioner of Health for the City of Milwaukee. Hello, hello. How are you? Good. I love your mask. It's so nice. We are also a hub giving out masks to the community. Well, I just wanted to say it's a great time to have you on because of all of the movement that's happening with the vaccines and everything with COVID. There's so many updates happening. So I want to confirm you're still the interim commissioner, right? Yes. Okay, I just wanted to make sure. Okay, well, thanks for being here with us and taking Claire Evers' spot. So let's get started. Right now, can you talk about who can get the COVID-19 vaccine? Yeah, I would love to answer that question. But first, if I can, I wanted to share an update that happened, something that happened in the legislation about using masks. So I want to make sure that everything's clear in the city of Milwaukee. The mandate for masks that Governor Evers put out in fall was rejected by the legislature today. That means that the mask mandate for the state is not in place. So you're going to hear a lot about that in the coming days on TV. But for the city of Milwaukee, it is still required to wear a mask in public places. And when you're out, when you're around other people. And that's because our Common Council approved a legislation around the masks. So I want everybody to know that masks are the way that we can prevent spreading COVID, they are required in the city of Milwaukee. Now, I want to say thank you. Now, let's talk about who can get the vaccine right now in Group 1A. Those are medical providers, first-line workers. So that would be nurses, doctors, therapists, personal care workers, ones that, come to your house, social workers, and then other folks, medical assistants, NPs, everybody that is in the medical care, in the medical trade, and then also individuals that are in security. So we're talking police, firemen, emergency paramedics, also those that work in shelters. If you work in a shelter, so that's another emergency service and you qualify. And then also those that are over 65 also qualify for the vaccine. So if you'd like, I can talk about registration. Yeah, let's keep going. So right now, to register, we have a program where you can go to make your appointment. And then right there, you can make your appointment. Hey, if it's not in the chat, I'll put it in the chat. It's milwaukee.gov/COVID-vax. That's the website. You can, answer all your questions about making an appointment, and it will help you understand if you are part of the groups that we just mentioned. We're also working right now about putting everything in Spanish. We do have a hotline. And so if you call the hotline, option 5, you will have individuals where they're bilingual. Bilingual individuals. So then they can use a language line to be able to understand each other. So I have to say that we don't have enough vaccines right now. And that is important. Because if you go to the website right now, because all of the appointments are filled up, what we're asking is that you go back every day to check. And coming back every day, then you'll see that you should eventually be able to schedule. And right now, since we don't have enough vaccines, it's a national problem, a state problem, not just in the city of Milwaukee. There are not enough vaccines available for everybody. So the schedule is going to fill up quickly. So can people register other ways, or is that the main platform? If you live in the city of Milwaukee, yes, that is the best platform. But if you're over 65 years of age, lots of different healthcare systems are also offering vaccines. So you can get a text, maybe from Ascension or Aurora. They'll send you a communication, and then you can register to get an appointment with your primary doctor. So if you have a primary care doctor, you should talk to them because they might be able to get you an appointment sooner than the city. But since we don't have so many vaccines, and that's everybody's, like I said, a state issue, everybody only has a little bit of the vaccine. Thank you so much for sharing that. Now, I do have a question. Lots of people are asking, what is the probability of having an allergic reaction after the vaccine? And what are doctors doing to be on the lookout? I think that's one of the biggest fears that people have. And what I can say is that typically the reactions, most of the time, you'll have, a sore arm, chills. That could be, up to 24 hours after the vaccine, after the initial vaccine. And that's not too common. It's as common as any other vaccine reaction. So the COVID vaccine is not causing more reactions than any other vaccine, like a flu vaccine. For individuals that had reactions to vaccines generally previously, they should talk to their doctor first before going and getting the vaccine. But for those that have gotten this vaccines before and they haven't had a problem or a reaction, okay, good. Now I have one more question before we finish up. Are there occasions when somebody gets their first COVID-19 vaccine and then they have an allergic reaction, or for whatever reason they decide not to get their second vaccine? Is there a side effect? There are some people that have reactions. We have seen you're tired, muscle aches. If you receive the first vaccine, you do have some protection against COVID, but we know that two vaccines is what gives the most protection. But if for some reason you don't want to come back for that second vaccine, you should know that the first vaccine does give some protection. Another question. Do you know the state number of vaccines in Milwaukee? I mean, like, how many are we going to receive based on the new presidential administration? Well, unfortunately, we don't know the exact numbers, but we do know the we do know there are more than 200 sites that have applied to be vaccination centers for the public. So we know that in the state, they're watching how they're giving vaccines, because if they're looking at the county, we have a very dense population and a very diverse population. So what we look at who has been affected by COVID, um, it is affecting people of color. And we have been fighting and advocating because we need more vaccines. We need them sooner. And to answer your question, I do know that the state is asking for more than 300,000 vaccines, and we've only gotten 78,000 throughout the whole state. We know that there are a lot of people that want to get vaccinated, but we just don't have that much of a vaccine. One more question. Are people going to be able to get other people sick if they've gotten the vaccine? Well, like I said, the vaccine is the same as any other vaccine. It's not a guarantee 100%. We're talking about 95% protection. So if you've gotten both doses of the vaccine and you still get sick from COVID, I mean, then I guess you could get other people sick. But you should know that it's very rare. If you have gotten both vaccines, you probably won't get sick. There is a period. So then there's a period after the vaccine that you can get other people sick? No, 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 no. I'm sorry. I don't think I understood that right. When you get your first vaccine, the vaccine doesn't have COVID. It's not an injection of a live virus into your system. So when you have the symptoms, those are just symptoms of your body reacting to what it thinks is COVID. And that is super cool about our health. We can create something that our body thinks is COVID, but it's not. So we don't have a reaction, and we can't get other people sick. Okay, thank you for clearing that up. Very good. Well, thank you so much for your time. I would love to speak with you again a different day, and it's always a pleasure to have you. Thank you. Very important information from Commissioner Jackson. So now we're going to keep talking about the COVID-19 vaccine, and we're going to share another video from Marlene. Scientists across the world are coming up with COVID-19 vaccines. Vaccines prepare your immune system to recognize infections. If your system is exposed, it will be able to fight it off. Vaccines can prevent illnesses and prevent that they are even more serious. They have to be investigated so much before they're approved. In Australia, they are looking into new ways to approve new viruses. You have to talk to your medical provider to be sure to get more information. We're hoping that Australia approves their vaccines by 2021. But in the meantime, wash your hands, keep your 6 feet of distance, and if you're sick, stay home and get tested, even when vaccines are available. So I'm seeing in the comments, and I see a very good, they're asking about what happens with people that work cleaning clinics. That's a really good question, and we're going to be sure to ask Claire Evers next time that she is here. I see a hello from Maria. Hello, hello. Thanks for saying hi. So now I want to share some information about the primary elections that took place yesterday. Yesterday was the primary election, and in SOC district, there was just one office on the ticket, on the ballot, and that was the superintendent of public instruction. So let me share this image with you. Okay, these are the two candidates, were the two that won. So now they're going to advance to the main elections in April. So Jill Underleaf, 31% of the votes, and Deborah Kerr, second place with 22% of the votes. So remember, there were 7 candidates in total. So that's why the percentages are low. Also, I want to share the map with you guys that shows the zones where each candidate won most votes. So yellow or orange represents the areas where Jill Underly won the majority of the votes. And then the brown is where Deborah won. So, as you can see, Milwaukee, Madison, Eau Claire, all the way up to the north of Wisconsin also, and then down to the south, that's where Jill Underly won the majority. And then in the other counties around Milwaukee and in central Wisconsin is where Deborah had the majority of the votes. I also want to share that the superintendent of public instruction and the other offices will be on the ballot in April, and SOC will be sharing information daily with you guys. Another thing, you can go and ask for your absentee ballots if you want to vote from home to, stay safe and keep your distance during the pandemic. You can do it from home. So I will be sure to share that information as soon as it's available, the process of how to get your absentee ballot, like I did the last time with the last election in the presidential elections in this year, last year. So now we're going to share an interview with you guys. It's a public ally that's working at Sojourner Peace Center. Hello, SOC followers. I am Alan Canacasco Rubio, public ally with SOC, and I am here with Southside Organizing Center. Oh, I'm sorry. Today we have Naomi Serna Hernandez. She is serving with Sojourner Family Peace Center. So thank you so much for being with us, Naomi. It's a pleasure. Can you tell us a little bit about the services that Sojourner offers to the community? And then, of course, the other services that they offer in Spanish? Yeah, of course. It's great to meet you. Thank you, Alan. Yes, I am the public ally right now working with Sojourner Family Peace Center. And this is an organization that can be found on the corner of 6th and Walnut. And it's in the biggest organization in the state that provides services for prevention and intervention for cases of domestic violence for victims and their families. And the services are completely free, completely confidential. We serve men, women, kids, young people, young adults, because domestic violence, a lot of people think it only happens to kids and women, but it does happen to men as well. So Sojourner offers their services to everybody. So talking about services, you said prevention. So legal services and things like that you offer to the community. Can you tell us a little bit about that? Yes. So about 5 years ago is when Sojourner started to move to the building where we are now. And so that building has 14 different agencies and organizations that work together with us. Some examples are Children's Wisconsin, Milwaukee Public Schools, MPD, and lots of other organizations throughout the city. So that way it'll be easier for clients that come to Sojourner can, get all of the other services in one spot. And it's a lot easier. It's less stressful. It's more convenient. And like I said, the help includes legal help, support services, emotional services, and then in my department, we also help with young people. So we had commented before about, one of my questions previously was about how can people access these services if they need them? Yeah, thank you for asking that. Services, the most common, especially when people are found in an intense, serious situation, is the shelter. And that is one of the services that we offer. So if there's a victim or a family that needs that service, just call Sojourner. There's a direct number that's available 24 hours a day, 7 days a week. And if you call that number, if it's an emergency or a very urgent case, there are bilingual folks that can answer in English and in Spanish. And then if somebody just wants to come, and ask for help, they can do that as well. Everything depends. Every case is different. Very good. Also, all that information and those numbers we're going to offer when we're on live. We'll put them in the comments so that way people can see them. Also, talking about when normally you guys go look for people that need these services, or do people usually come to you guys, or how does the process start, or what about this? How does it all start? Yes, we have lots of different organizations and agencies that work with Sojourner. So I imagine that lots of the clients that receive services from those organizations also come to Sojourner and they'll receive our services. And then there's also employees that are dedicated to going out to the community and communicating with individuals and different services that are offered. Um, anything that they might need. Very good. Well, I would also like to mention a little bit about or the projects that you are serving and working on with the organization with Sojourner. So, can you tell us a little bit about that? Yeah, of course. Well, right now I am in the in the kids and adolescents group. Sojourner calls that children's program. But basically, what we're doing is offering support for kids and young people that have been impacted by domestic violence and that have been witnesses of that kind of violence. So we help them to be able to process and heal from those experiences. And we also offer all kinds of different support services so they can have fun and heal in a peaceful way. I specifically was assigned to the visioning team. Basically, that is a group of employees that is organized to be able to plan a new direction, a new mission for the department, for the kids and adolescent program. So, what we're doing is trying to create a department and a program that focuses on breaking the cycle of domestic violence, which is so common right now. Very good. Well, perfect. Naomi, thank you so much for being with us. Anything else? Anything that you'd like to share about Sojourner? Well, Sojourner, like I mentioned, anybody can come and use our services, confidential, free. And then also, I wanted to emphasize that within the community, within the Spanish speaking community, if you're worried about your legal status, it's important to still receive these services and receive this help. Your legal status does not affect It's not a factor that will affect the services that you will receive from us. Yeah. I'm sorry, I couldn't think of it in English. Yes, that is very important to know because a lot of people in the community, might be worried about that. It's, your legal status or immigration status. So it's good to know that Sojourner doesn't have a problem with that. No, there are no legal consequences. It won't affect you. If you're a victim and you need help, if you need the help, we are here to be able to help. Very good. Thank you so much, Naomi. And thank you for being with us. It was great to meet you. And we'll talk again soon. Thank you. Goodbye. Has this forum been informative? What part of the forum can we change or make better? Let us know by responding to a quick survey that can be found in the comments section. That way we can keep the forum going for the residents. And thank you for tuning in. Well, we've come to the end of our community forum. So I just want to remind you that we are going to have Dr. Perez and Carrie Ackerman from 16th Street Clinic tomorrow with Marlene. And then Friday, we're going to have Carrie Cooper to talk a little bit about a project that's going on the north and the south sides of Milwaukee. And she is from Sewer. So thank you guys so much for being with us. We hope that you fill out the survey that is, from the video that we just shared. And so we will see you again tomorrow, another community forum. And I'm going to leave you with a video thanking our sponsors and all of those that watch the program. Hey, SOC followers, I'm Alan Canacasco Rubio, public ally assigned to SOC. We would like to thank everybody for supporting our 3 o'clock with SOC show and for completing our survey. The link is found in the comments. Other than that, we would like to thank everybody for turning in, for sharing our program, and we would like to thank the following sponsors: Wisconsin Voices, Community Development Block Grants, Neo Philanthropy State Infrastructure Fund, Movement Voter Project, Catholic Campaign for Human Development, Zilber Foundation, City of Milwaukee Office of Violence Prevention, Tides Foundation, Employ Milwaukee, and all of the faithful individuals that have given personal donations. Thank you very much.